When the world is just too much, turn it off and turn on positive, encouraging K-Love.
I'm gonna praise.
World off. K-Love on.
K-Love is sunshine for my soul.
I love K-Love.
Listen now on your radio, online, or on the free K-Love app.
K-Love makes me feel so good.
Positive, encouraging K-Love.
Okay, Medicare Moments is the podcast. Toni King is your all-knowing Medicare host. Hi, Toni King.
How are you doing, Jim? And this one is very important because a lot of people get confused when they're turning 65, and especially when we have Medicare's open enrollment, which used to be called Medicare's annual enrollment, but now it's open enrollment, like you're brand new. And people get totally confused about it.
So the title of this one is I'm turning 65 in November. Does Medicare's fall enrollment time affect me? Dear Toni, I'm stressed about what I need to do to enroll in Medicare because I'm turning 65 in November and am not receiving my Social Security check since I'm still working part-time with no employer benefits. I only have individual health insurance. I need my Medicare and Part D plan to begin on November 1st. I'm concerned about how Medicare's fall enrollment time affects me since I will be applying for Medicare. How can I ensure I enroll in Medicare the right way? Thanks, Toni. Joshua from Kansas City, Kansas. Well, Toni, it's always good when people reach out and ask you how to enroll the right way.
That is true because you only get one time. If you mess up on your how to enroll, it affects you not today, but the rest of your Medicare life. I saved you, right?
You did. Thank you.
People need to realize that it's now called Medicare's open enrollment. OEP is what they put down, but it's the same as Medicare's annual enrollment, which is what it was called 2 years ago. And that starts October 15th and ends December 7th. This time is for people who are already on Medicare and need to make a change with their Medicare Part D plan or Medicare prescription drug plan. This has nothing to do with what Joshua, that's the gentleman that wrote the letter, is concerned about because his Medicare is starting in November. He turned 65 in November, and that's called Medicare's IEP, initial enrollment period. That's his IEP. You had an IEP and I had an IEP when we turned 65. So he can enroll 3 months before for it to start November 1st, the month of November, and 90 days after. That's November, December, January, February. After February, if he has to enroll in Medicare, he's got to wait until the next year and he'll get a penalty. So you want to make sure you get it going the right way. If you are turning 65, not working with employer benefits.
And we're going to talk more about this after this important break. Don't go away. We'll be right back.
Hi, everyone. If you've been injured in an accident that was not your fault, listen up. We have legal professionals standing by to answer your questions for free. Call now and find out if you have a case and how much it's potentially worth. Call 800-710-5100. I'm here with spokesman John Wolf. So, John, tell everyone listening who should call right now.
Well, Maria, first off, thank you for having me here. It's always nice to answer the listeners' questions. Now, as far as who should call in, anyone who's been injured in an accident and think you deserve compensation, give us a call right now. 800-710-5100. You'll find out if you have a case and how much it's potentially worth.
Thanks, John. You heard it, folks. Take advantage of this opportunity and call now. 800-710-5100.
Advertisement sponsored by Legal Help Center. May not be available in all states. Not available in California.
You're listening to Medicare Moments. Toni King talking about the first time you enroll in Medicare. It's very important And she's talking about the window of time, the opportunity of time you have around that birthday when you turn 65. And in this case, no employer benefits, right, Toni?
Right. He's like me. I was on an individual health plan. You were on an individual health plan.
Right.
Pretty close. So
Pretty
if
close.
you're turning 65, I was self-employed. I was still working, but I had an individual health plan, so I needed to enroll in Medicare. So I did that when I was turning 65. If someone is still working when they're turning 65, then just take your time. You can go online to the Toni Says, ToniSays.com website. I've got the Medicare First Steps that you can download, and it goes through all of the different times that you can enroll. And if you're turning 65 and you're working and you need to enroll in Medicare, there's a special way that you need to enroll. You got to go online to ssa.gov. Social Security does all the enrolling. Medicare does not enroll you in Medicare. Social Security enrolls you. That's what confuses everybody.
Social Security does. And you can do it online, but you can also make an appointment and go to a local Social Security office, right, Toni?
Yeah, generally, but they'll tell you to go back to your house and go in and enroll online. If you're turning 65 and you need to enroll, they'll show you how to do it, or they may be nice enough to help you. But if you're someone that's still working past 65, and then there are certain ways that you have to enroll, and we've done the talk on that. There's forms that you need to file. That gets confusing. But right now we're talking about somebody that's turning 65 and what he needs to do. He just needs to make sure that he enrolls 3 months before, the month that he turns 65, and 90 days after. After 90 days, if you are not working with employer benefits, you better get on and enroll in Medicare off of the Social Security website. Yeah.
So you don't have a penalty that follows you around the rest of your Medicare life.
That's right. And people need to realize that if you're not receiving your Social Security check, which is what Josh was doing, he's waiting to get his Social Security check so he can get 100%. But he's not working with employer benefits. He needed to go on ssa.gov/Medicare/sign up and enroll online, and it'll start. It's very simple. Or you can contact us at 832-519-8664, or you can email me at info@tonisays.com, ToniSays.com. I'm Toni with an I and not a Y, because I am a girl.
Got it, Toni King. And it's really, really important that you even share with your friends the First Steps guide that Toni has created for you. It's free. It's a free download. It starts you on your way. And if you need more information, you can call Toni 832-519-8664 and tell your friends about it. It's ToniSays.com. Great website. Lots of material there you can use to start your Medicare journey.
And once you get your Medicare in place, then you go on Medicare.gov and open yourself up, and you'll have your Medicare card to be there if you haven't gotten it. I mean, everything's there. It's a great website. And you want to decide, am I going to go with the Medicare supplement or a Medicare Advantage plan? That's our next podcast that we're going to do, is in the two plans.
Thanks, folks, for listening to Medicare Moments with Toni King. Tell your friends about it. It's one of America's top Medicare podcasts, one of our top 10 Medicare podcasts. And we appreciate your listening, and we appreciate you sharing our information with your friends. Toni, back to you.
Okay. Well, I will see you later, Jim.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.